having on and off neck and shoulder pain since a few years now. Never took it very seriously till it became quite severe a few weeks back. And so, since I hugely believe in alternative therapies, I headed to Dr. Gerry in Emirates European Medical Center. I felt much better in just 2 sessions. So I decided to feature Dr. Gerry on the Uma Show so that he can help you too. Dr. Gerry, welcome on the Uma Show.
Uma, thank you for inviting me. It's a pleasure to be here.
Well, before I start anything about chiropractic as a practice, I would like to know about your story. How did you get into it?
Oh, well, okay. Well, I'm originally from the US, so you might be able to detect my Bostonian accent. I try to hide it, but I've been in Dubai for the last 10 years, in practice for 30 years.
Okay.
Got interested in chiropractic from an experience in my childhood with my mom. My mom suffered from terrible neck pain, and one day, it was right before her sister's wedding, she woke up with an incredibly stiff neck. Very, very frustrated. Her head was on her shoulders, crying. What was she going to do? How she's going to attend her sister's wedding? Long story short, went to a chiropractor, went to the wedding, neck pain was gone. But more importantly, my mom has been diagnosed with MS. She's lived with it successfully for the last 30 years. But that chiropractor made the diagnosis of MS with her, told her something wasn't right, needed to be investigated. And I said, wow, if I can do that with my skills, I want to do that. So I was always interested in traditional medicine, but more and more I became interested in chiropractic. When I was in university, I actually had one of my professors tell me that her experience with a chiropractor, she was addicted to pain medication because of her back pain. She started to go into a chiropractor, boom, and off the pain medication, back pain gone. And that kind of cinched it for me. Went to chiropractic school and haven't looked back since.
It's amazing. It was almost 30 years back and alternative medicine was not as popular at that time.
Yeah, when I first graduated and went into practice in the Boston area, Boston, for you who don't know it, center of traditional medicine. So chiropractic was really frowned upon, really not viewed as mainstream. I actually was one of the first chiropractors to make my way into the hospital system. I was on staff at a hospital, long process, and what a 30 years have changed. Chiropractic is now the largest alternative doctoral level profession in the United States.
So that brings me to my next question. What is chiropractic all about?
Awesome question. Get asked that all the time. So a chiropractor is a doctor who specializes in the relationship between structure and function, especially the impact of function on the nervous system. So chiropractors look particularly at the spine, but also on other joints and their impact on the nervous system. So I hear a lot of patients asking me, can you align me? Can you put me back into? And in an adult patient, that's very difficult. In a child whose spine is much more flexible, you can see these structural changes. But in the average adult, what we look for is the optimization of function. So I tell patients, I'm a body mechanic. You have a high performance sports car, I'm gonna get that sports car to run as best as it can for you. But I can't make a 2000 sports car run like a 2019 sports car. So we work with what we got.
So what are the ailments it can address?
So one of the biggest I see a lot of, and patients mostly come in for back pain, neck pain, disc problems, sciatica, arm pain, and a variety of sports issues. All functional, mechanical, locomotive, movement problems. And that's my particular specialty. I have board certification in orthopedics. I'm also what's called a primary spine practitioner. So my focus is mainly on spine-related problems and sports injuries.
So Dr. Gerry, who should come to a chiropractor?
Great question. So if you have a spine, you might need to see a chiropractor because we are the spinal specialists. We are not surgeons. We are the conservative experts for the spine. So in our practice, we see basically from infants to senior citizens. And again, a lot of times, depending on the patient, you tailor the treatment. For example, we're not certainly going to treat an infant the way we're going to treat an adult. And some of my female colleagues treat the infants and babies. A lot of times they come in complaining that the baby's colicky, not sleeping well, not nursing well, and these can be helped with gentle chiropractic manipulation. I love to work from toddlers to the adults. I love them when they start walking. And as you know, the toddlers, they fall, they jump, they run, and they bumps and bangs. And what's great about kids, they're like little elastic bands. So they only need a little bit of treatment and they usually respond really, really well. Another area that we have our forte in is pregnancy. Okay. I see a lot of pregnant women. Actually, I have some great OBGYNs that send me in their patients. Why? Because you can't give a pregnant woman any medication. And guess what pregnant women have? Back pain. So as soon as that uterus starts growing, boom. If they didn't have back pain, they usually have it. And there's nothing that can be done from a medical standpoint as far as from a medication standpoint because you don't want to complicate that pregnancy. So my OBGYN colleagues, they send in the pregnant woman for an evaluation. We get their pelvis moving. We address some of their pelvic floor weaknesses, some of their growing uterus issues, do a little bit of massage. On top of that, maybe a little pregnancy support bracing, and it works wonders. And then 6 weeks after they have the baby, boom, we're right back to strength and stability because having a baby does a number on a woman's body, and we need to get them back to the stability state that they were, or even better, prior to the pregnancy.
Well, I think that's very enlightening to know that even babies can come to kind of...
Yeah, a lot of babies, like I said, the biggest thing we see infants for in the office, some of my female colleagues see, is for colic. And when they're treating the baby having restless sleep, and my colleagues will treat them and they'll go right to sleep on the table. It's amazing.
It's amazing. Yeah. So when is the right time to visit a chiropractor?
Well, my philosophy is the sooner the better, okay? I like to see patients before they've gone through every other doctor. I see a lot of patients who come in as a last result. What I tell patients is, I'm here to decide and train to decide if I can help you or not. And if I can't help you, then I'm going to send you to whoever's going to help you. I have a great relationship here in Dubai. I've been here almost 10 years. I work with a lot of other medical practitioners. I just spoke at one of their spine conferences a few months ago. So I work with a lot of different surgeons, neurologists. So what I like to do is see what's going on with the patient and go from there. And a lot of patients ask, do I need to have an MRI? Actually, no. Latest studies show this. MRIs, they're very confusing. Patients with good MRIs feel bad, and patients with bad MRIs feel good. Imaging, it's a tool, but the most important part is the clinical history and examination.
That's a very important point.
About 80 to 90% of the diagnosis can be made from a good history and clinical exam.
So from your point of view, what are the things that we need to take care of on a daily basis to just take care of our body?
Okay, so first of all, most of us sit too much. You need to get out there and move. And even if you're having pain, or even if you don't want to exercise, get out and walk. 20 to 30 minutes of light, moderately paced walking does wonders, okay? Studies have shown the more you sit, the more health problems you have.
Absolutely, and something that I keep talking about on my social media, movement is so powerful.
Movement is key. Movement is the key to life. We as human beings were meant to keep moving. When we stop moving, we have problems. And that's a real good point that you mentioned about the pain. When patients have pain, they don't want to move. Instinctively, they stop moving, and that's absolutely the wrong thing to do because your brain starts to get conditioned into the signal that I shouldn't move. We have to retrain the brain that movement is okay.
Now let's talk about me. So I came to you a week back and I already did 2 sessions with you. I came with a severe shoulder pain. I feel much better.
Great.
And of course it started a few years back, kind of become a chronic pain. What did you see and how did you treat?
Okay, so Uma, you're typical of the Dubai patient that I see. Very busy, and they live with the pain for a while until they reach a critical point that boom, they can't handle it anymore, and that makes them come in. Help me now, fix me, get me out of this pain. The 5 most dangerous words to a patient are, maybe it'll go away. When we ignore the warning signs, this only leads to more problems. So you came in, as you said, with this history of cyclic neck pain. Get better, get worse, get better, get worse, maybe it'll go away, until it reached a head where can't deal with it anymore. Actually, it was your husband that brought you in because he's one of my patients, and he told you to come in because he couldn't deal with it anymore, right? So what we did is we did a nice history, found out this was a recurrent issue, found out what the issue was, found out that, yeah, nothing really serious to worry about, mechanically oriented, coming from the joints of the neck. Those are called facet joints. Those are the gliding joints. And on top of that, when those joints overwork, they create a lot of tension, muscle spasm in the area. And a lot of people think that their problem is just muscular. But with you and a lot of people, the problem is really more spinally related, and the muscles and the pain are just a symptom.
So I'm ready for another session.
Great. Let's see what's going on. We're going to check her range of motion, because the first time when she came in, her range of motion wasn't too good. So Uma, turn your head to the right far as you can go. Any pain with that?
No.
Good. And now turn your head to the left. Any pain with that?
Very little.
Okay. So initially when she came in, her rotation was restricted and painful, mostly on that left side, yeah? So next thing we're going to do is check forward flexion. Go ahead and bend forward. Any pain with that? And bend back. Any pain with that? Good. And that's much better.
Much better.
And lateral bending, bend to the right. Any pain? And left. Any pain?
Very little.
Okay. So motion overall looks improved. Let's take a look. We're going to do some palpation, which means I'm going to feel the joints of her neck and the muscles. Let's see. So if I go in here to her trouble spot, already she had a lot of tightness here initially, but this joint in through here no longer inflamed and irritated. The muscles aren't as hypertonic. Really good. So I'm just going to palpate. Any pain in here at all?
No.
Yeah, really much better than it was. When I palpated her for the first time a few days ago, was really tender in that area, yeah? And this side feels well as well. And even her upper trapezius muscle, which is a trapezius is a diamond-shaped muscle that inserts from the base of the skull all the way to the mid-back. Her trapezius muscle, little bit of tightness in through here, little bit here, but not nearly as well. So she's the typical great patient. Awesome. Thank you so much for responding so well. This is the third visit.
That's
and she's doing well.
Excellent.
Great. That's what we love to hear. Good. Okay. So let's go ahead and just do a little cleanup. In through this area here. We're going to give a chiropractic manipulation into this area here to unlock the thoracic spine, because the spine's all interconnected. The cervical spine is connected to the thoracic spine. You can see I'm very proud of her. She's been doing her postural exercises. She's sitting up much straighter for me. We'll go over that in a minute. But let's adjust her mid-thoracic spine. Okay, great. So go ahead and sit for me here. Put your legs right here. Turn towards me. Legs straight down. Okay, now I'm going to have you give yourself a big hug. So cross your arms in front. And I'm just going to take your arm. Good. All right. And head down. And I'll have you take a deep breath. Hold it for me. I'm going to lower you down. Come down with me. Blow out that breath. Let it blow out. Good. Excellent. And one more. Deep breath. Blow it all the way out. Blow out that breath. Good job. A nice low release there. Was there any pain with that at all?
No.
Chiropractic treatment should never ever hurt. Swing your legs this way. Slide forward, feet on the ground. Okay, now I'm going to go right in this area here. We have a little bit still there, so we're going to take care of that now. Okay, so sit up nice and straight. Good. Drop your head. Take a deep breath and blow it all the way out. Deep breath and out and relax. Let your head drop. Good. Good job. Just a little click. Nothing much. Yeah? Perfect. Yeah? Excellent. Good. All right. And we'll just do a little bit of manual soft tissue release in this upper trapezius. And then we're going to do a little bit of physio afterwards, because in this office we use multidisciplinary care, which means we have a collaboration of a bunch of different practitioners, chiros, physios, acupuncturists, homeopathy, because we treat the whole patient here. Yeah, okay, turn. Any pain?
No.
Good. And now? Any pain?
No.
And now? Any pain?
Mm-hmm.
And now? Any pain?
No.
Perfect. So, third visit, she's doing great.
Much better.
But it's time to show us your exercise. Yeah?
Okay.
Okay, so we're going to show her, she's going to show me Brugger's exercise, which I taught her.
Yes.
Okay, in 4 steps, okay? And this is for posture and also to relax the upper back muscles, okay? So, take me through it. Remember,
so
step
while
1?
sitting, yeah.
Step 1, shoulders back.
Shoulders back.
Excellent. Step 2, rotate the arms out. Good. Step 3, tummy tight. Step 4, double chin. Chin up slightly. Good. And don't forget to breathe. In and out, nice and slowly, 10 to 15 seconds, 5 times a day. And what we're doing is we're training her brain, not the muscles. We're training the brain that an upright position is more important than a slumpy dumpy position. A lot of times what we do is to reinforce this, we'll use a special type of elastic tape that's called rock tape to bring the shoulders back, because especially females have a terrible position. They tend to slump over because of the weight on top of their chest. And the other thing we have to remember is a lot of people work on computers and laptops, iPads, and they're in a constant state of flexion with those shoulders rounded. This is not ideal. It creates a lot of stress and strain in the neck, and I'm loving it. Look at how she's really training herself to sit up straight. Usually takes about 30 days to change a postural habit, and she's well on her way.
These sessions have not only helped me with my pain, but they have also helped me with my posture, as you can see. For more details on Dr. Gerry, see below. And I'll see you in the next episode of The Uma Show. See you for now.